there are many, many ways to manage the side effects and pain associated with prostate cancer. Some guys like me, you elect not to do some of those things because I take a whole bunch of medications every day just to treat the prostate cancer.
Well, I think a lot of men with prostate cancer now, the older ones in their 60s and 70s come from a generation that are very stoic and just don't really like to express discomfort. And they're coming in with their families, sometimes their children, and they're just very reluctant to say anything.
He was really strong about pain. He didn't tell me when he had pain a lot.
So one thing I've always done is watch them very closely because they can't hide the pain completely, and you'll notice them shifting or doing something and sort of asking some gently directed questions. Is your pain really well controlled? And sometimes it's actually the family member who jumps in because the patient themselves will say, no, I'm fine. And the wife will say, no, you're not. You can't do what you did, last week. And there is a little bit of dynamic there where there can be a disagreement, but at the end of the day, you can figure out what really is going on from a pain perspective. And I think with some gentle prodding, you can get men to come forward with their symptoms a little bit more. And I think the main thing is letting them know they're in a safe environment where they can say whatever they need to say.
There are lots of ways that we can treat pain for men with advanced prostate cancer. Oftentimes, pain comes from prostate cancer that has spread to the bones. And one of the best ways to deal with that pain is with radiation, if it's a single site of disease in the bones or even a few sites.
Pain medication can kind of mask the pain, but it doesn't get to the cause of it. And so depending on the situation, we'll use radiation or surgery or something else to address it. But basically what we try to do is use the radiation to shrink the tumor. Over the course of about 4 to 8 weeks, the tumor will shrink, and the majority of men will get pain relief from that.
The other option for pain, if we find that it's happening in multiple places throughout the skeleton, is radium-223, or Xofigo. It's a really exciting approach. The molecule actually acts like calcium when it gets into the bloodstream. And just like calcium, it travels to the bones and is incorporated into areas where bone is being built. And areas where bone is being built most rapidly are actually areas of prostate cancer metastases or spread. So once the drug is in the system, it goes directly to prostate cancer metastases, sort of like a Trojan horse. That medication both improves pain by treating multiple prostate cancer metastases all at once, but it also makes men live longer. So that's one of our most exciting new developments in the treatment of advanced prostate cancer pain.
There's ways to do it. You can treat the pain, right? You can take drugs that will help you with hot flashes, will help you with the joint pain, that will help you with if extreme fatigue is a side effect. And I would say don't be afraid of all those things. If it helps you get through the day, if it helps you achieve that quality of life that we talked about, you should explore all those options with your doctor.
There's no reason to be embarrassed about incontinence or pain. It's nothing to be ashamed of. These are things that modern medicine can treat. You should be taking advantage of modern medicine and managing these symptoms. So I think that's the most important thing.